Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, this is a fun episode. I have the amazing Dr. Tim Evans with me. Dr. Tim Evans is a boarded theriogenologist and also a boarded toxicologist. He is a professor at University of Missouri's College of Veterinary Medicine, and darn, he is fun. I think you guys are going to love this episode. I love getting to meet Tim, and my team still talks about getting to work with him. So he is super fun. And this is one of those episodes where there's somebody who, gosh, they know their stuff and they're just telling stories. And it is awesome. And so if you learn from stories and examples and anecdotes and you soak that stuff up and it sticks in your brain, I got something great for you today because you're going to learn some stuff. This is really, this is my favorite way to learn. Anyway, this is a wonderful episode. It is brought to you ad-free by Hills Pet Nutrition and their Hills Veterinary Academy. Guys, if you've not checked out the Hills Veterinary Academy, it is an amazing site for educating the entire veterinary team. Have a look at it. There's some links down in the show notes you definitely want to check out. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Tim Evans. Thanks for being here.
Well, this is great. I have dreamed about being on the Cone of Shame. Absolutely
Nightmares.
Dreamed about it.
Oh my gosh. You are too kind. For those who don't know you, you are a veterinary toxicologist. You were at the University of Missouri's College of Vet Medicine. You were also their public engagement and continuing education coordinator.
Yeah, that's a mouthful, isn't it?
It is. I had to write that one down. I was like, I'm not going to remember that. But yeah, it's great. Man, you are so much fun. I am super glad to have you here. It's time for a quick refresher for me. And I realized this last night when I was having a cookout at my house, and I had a bunch of friends that were over and we were doing shish kebabs, and one of the kebabs hit the ground and my goofy dog snatched a big hunk of onion off the end of the kebab before I could get there. And I thought, oh, well, that's not good. But how bad is it? Let's think. And so I thought that you and I could get together and start to talk about some, we should get into toxins is what I was thinking. And then specifically, so anyway, we're due for a review on nephrotoxin. And so that's kind of what I wanted to get in today. I was thinking about, let's think about kidney disease. The A to B to C there is kind of winding and convoluted, but that's kind of how I got here.
Yeah. Well, on the onions, I mean, eventually if you have severe enough of a dosage, and again, a lot of it in veterinary toxicology. I mean, everything is toxic. Okay, you watch the TV, you listen to the music, everything is toxic. Britney Spears is toxic. Taylor Swift is toxic. Something's toxic.
Something's toxic.
But everything is toxic. But I think it all really comes down to the level of exposure. How much is an animal exposed to? And again, so that comes down to how much onion, how big the dog. Okay. If it's, and is it just a one-shot deal? The dog counted to 5, got what it was, ate it. Probably not a problem. If that's your daily routine, that you have people come every day. I mean, we had some folks years ago. They decided they were going to grill steaks every evening, and they felt bad for their Great Dane. Okay. So they went ahead and grilled onions for their Great Dane. Now, does that sound like a fair exchange? The dog wants a steak and they're grilling onions. So they gave it onions, and for approximately like a month, 6 weeks, 2 months, it got grilled onions every night. And then the dog started acting kind of lethargic, and they brought him in. The dog was anemic. And then, incidentally, they get this history. And, all we're trying to do when we're talking about our patients is we're trying to get a history. We're trying to get what's the examination. We want to come up with what are the problems. And then we want to figure out how do we fix things. Well, this dog was anemic. And in the story came up with the onions. And luckily, onions will destroy red blood cells, cause hemolysis. Okay, that can cause hypoxia. It can also affect the kidneys. I mean, a lot of these things that are out there, and again, everything is toxic. If there's enough of it, you can potentially go ahead and get some adverse changes in the case with onions and in the red blood cells, possibly in the liver, in the kidneys. But it all comes down to, how much. And again, this was a Great Dane. Usually when I get a phone call and someone says, hey, I got a Great Dane, it got into something, I'm thinking, well, it's going to have to get into a whole lot of something to be a problem. I mean, most of the time when we're talking to our colleagues, if someone tells me they got a Shih Tzu or a tiny little Chihuahua or something like that, and it gets into something, I start listening pretty carefully, because the possibility of that being a problem goes much higher than when you've got a lab, which thank goodness they eat everything, or I've got a Great Dane. So.
Yeah. No, that makes sense to me. It also makes sense. Your old nutrition history for the win, is trying to tease that out. Do you have questions when you're looking for toxins? Ways that you like to ask questions to pet owners that you feel like get them to kind of tip their cards a little bit? Or it's amazing to me how often I'll say, well, what does she eat? And they're like, oh, nothing, just regular stuff. And 35 minutes later, the onion story will come out. And I'm like, well, why didn't I get this early on?
Yeah. And I think that's one of the things that makes it a bit hard in veterinary medicine sometimes. And that medicine in general, you've gotten to the point where you got 15 minutes to figure out what's going on. And, we had a situation over at the veterinary health center where an owner, some really very good owner, had, I believe, retrievers, brought in dogs all the time. She brought in this dog. The dog was acting kind of depressed. She thought maybe it was a problem with a dewormer that she had used. And then they got some blood work. And then the dog they found something it was an older golden retriever. They thought possibly there might be a problem like some type of cancer or something like that. And you get into a referral center and we're looking at everything in the world and trying to figure out what's going on. And so they're working we got people working on this part of the dog and people working on this part of the dog. And they said, she still thinks it could be some kind of poisoning. And she said she wanted to know if you'd come over and visit. And, a guy like me at the time, I was in the diagnostic lab. I mean, actually being allowed into the hospital. I mean, that's like being on the cone of shame, Andy.
Right.
It's like being on the cone of shame. So I got in and, I sit with the client, we're talking about it, and she said, well, the dog was kind of acting kind of drunken and it just didn't. And there was, she thought that it could be this dewormer. And then she'd had a lot of people, a lot of workers working around the house, and they'd had a bunch of vehicles and all of this. And she said, well, what kinds of things can cause this kind of, behavior? And so I going down the list of things, and, there's the ivermectins, the macrocyclic lactones, that class of drugs. And then I'm getting in, and then there's alcohol, there's bread dough, yeast decides to rise in the animal. So then you get ethanol. And I said, well, there's always ethylene glycol. I mean, it's, were there any, dripping radiators or anything like that? And she said, well, they had a bunch of vehicles there. And she said, well, how do we figure out if that's the problem? I said, well, you got a complete blood count. You got a blood panel this morning. We went ahead, we got a urinalysis. So, we go ahead and we've got some blood work on the animal. We got a CBC. We got a chemistry panel looking at liver, kidney, a variety of different organ systems. And then we get a urinalysis. Okay. We can look at those results when we get them, and that can give us some idea, if we're concerned about a possible exposure to ethylene glycol, maybe that could have occurred. So we go ahead, At the end of the day, we get the blood work. We're all thinking this chance of it being ethylene glycol is like next to nothing. And all of a sudden, what we do, we get the urinalysis, and we've got calcium oxalate monohydrate crystals. We've got an increased anion gap. And this dog, and it was not something on the radar, had gotten into ethylene glycol. Excellent owner, breeder, made sure that everything was just right. But when you get a lot of people and a lot of things happening, who knows? And ethylene glycol is generally pretty sweet, and it doesn't take a lot. This was an older dog, and unfortunately, this dog ended up going into renal failure. It's those are the kinds of things, and so we don't, everything is toxic, but again, it depends on the amount, and sometimes it's the simplest things. You're in a clinic, we're always looking for the most complicated thing that it could be. We're looking for zebras. We're not looking for quarter horses or Appaloosas, or if you're in Missouri, we're looking for Missouri foxtrotters. Okay. We're looking for zebras. Well, this happened to turn out. And again, everyone, when we talk about intoxications, they're not, in many cases in a practice, they occur, but they don't happen as often as people think they're going to happen. Everybody thinks their pet has possibly been intoxicated. And so, we'll say, well, no, it's got to be this, it could be that. But then all of a sudden, every once in a while, not very often, I become useful. And, I actually have I actually go ahead and become relevant. Years earlier, of course, everyone accuses me, it's always going to be something toxic. Years earlier, I'm in the VHC. The second time they let me in it. And then there's this Great Dane, and this Great Dane is in there. And the Great Dane had surgery on its spine. They thought it was a wobbler. I was there for another reason, but they were taking the pictures and pinching it. And this dog all of a sudden goes ahead, and he takes his head, and it just kind of looks like this right at you. He looked like my roommates, my first year of vet school, on a Saturday morning. He just looked like that. And I said, could this dog have gotten into ethylene glycol? And the residents looked at me and they said, Dr. Evans, you always think it's an intoxication. I said, I can't help myself. So I was working on my PhD at the time, writing my dissertation. So I was working into the wee hours in my office. And so I'm writing on this dissertation. And all of a sudden I get this phone call, and it's from the people over in the ICU. And they said, Dr. Evans, this is amazing. We went ahead, we looked at the blood work on the dog. The dog had an increased osmolar gap. And just at that point in time, he vomited, and this fluorescent green fluid just was all over the floor. Dr. Evans, you were right. And I said, well, yeah. No. He said, whoa, okay. So they said, well, can we test it to see whether it's the fluorescent green? I said, yeah, I've got a really expensive test for that. We're going to take that vomit and we're going to see if it freezes. Okay. And I'll know pretty quick. Didn't freeze. Okay. That's what it was. So those kinds of things, I mean, we started out with a Great Dane and onion, and now we're a Great Dane with ethylene glycol. And, it's funny when you talk about trying to go ahead and get a history, how you never know when that pearl of information is going to pop up that actually gets you thinking. A dog had surgery, so great. It had to be that it was a wobbler, had to be something was going like that. The fact that this dog had probably drunk a half gallon of antifreeze seemed to not be in the card. So again, there's a lot of things that people don't recognize that are around the house that are in our homes that potentially can be problematic. And again, oftentimes it's just people's natural to think that it's somebody else possibly trying to poison their pet when it's actually just things that are around the home.
Yeah. Stepping back real quick, the frozen vomit test, is that written down somewhere? Can you look that up, or is that an actual diagnostic test, or did you just?
No, it's a
Okay.
doctor. It's
All
a
right.
Dr. Evans. It's
I
a
was gonna
Dr. Evans. It's antifreeze. Does it freeze? So there you go.
My head kind of exploded for a moment. I was like, I've never heard of this test, and like, I'm adding that. I'm adding that to the hillbilly bag of tricks that I have, which is like,
Yeah.
wow, is this?
I mean, I think that's the kind of thing. I mean, I had a guy I taught with, and everything had to be. I don't know whether he grew up with Jimi Hendrix in a fluorescent poster with a black light, but everything was a black light. You used a black light to diagnose everything. Okay? If it was ethylene glycol, put a black light in its lips. If it fluoresces, it got into ethylene glycol. Even though the fluorescent dot, it's added as an indicator, but he did everything with black light. I mean, so I guess I'm simpler than that. I'm figuring if it's something and it's antifreeze and it doesn't freeze,
No,
that's good enough for me at least. And then you can always test it, but fluorescent green, the dog's got the clinical signs, it doesn't freeze.
Oh, I love it. I was just kind of flat-footed there for a second. I was like, oh, no, that totally makes sense.
Well,
That's right.
Like the Kona Shame All-Stars now.
That's exactly it. Like, I'll add you to the list of people who had insights that I had to just sit with for a few minutes before I actually really process what he's saying.
Well,
Okay.
I graduated. I mean, I've been a vet for 41 years and I've been about several different. I would have never dreamed when I graduated from UC Davis in 1982 that I would be a veterinary toxicologist in Missouri 41 years later. Okay. And I just came to Missouri for 3 years and I've stayed 30. So
there you go. Yeah.
It's just the way it goes. But I think the thing is that I think these cases are a good illustration of things that we find around our house that are potentially a problem. Some of them you got to consume a lot of. Okay. For ethylene glycol, a dog, has to consume about 4 to 6 mils per kilogram. And that's pure ethylene glycol. So let's figure if it's half ethylene glycol, it's got to be close to 10 to 12 mils per kilogram. Let's figure you got a 20-pound dog, 10 kilogram. That's 100, close to 120 ounces. Okay. I mean, close to 120, not ounces, 120 mils. We're talking 4 ounces. Okay. Got to do the math there. So let me go back in that. We got the dog. So we got about 4.4 to close to 7 mils per kilogram of pure ethylene glycol. Okay. Is going to be toxic. All right. But let's say we've got the normal antifreeze. It's about 50% ethylene glycol. Okay. So it's up to about 12 mLs. You go ahead and you take a 20-pound dog, 10 kilograms. That turns out to about 120 mLs, 4 ounces. That's a pretty good amount of ethylene glycol. That's a 20-pound dog. Go ahead and take a 100-pound dog. You've got quite a bit. So, and again, it's the one thing. And vet students love math. They love math. So do veterinarians actually. So
there's a right answer. Yeah.
Yeah, but again, we have to get the calculations. And so a lot of what we're doing is trying to figure out, one, was there, when I diagnose something, when I'm working up a case, I'm looking at, okay, we got an examination, we got a history, and then we got to come up with the problems. What are the problems that we're looking at? And as we look at the problems, then we want to get into the fact, okay, so we're looking at the problems. What are the explanations? Could it be, what about this could be an intoxication? And oftentimes we come up, there's nothing, okay? There's nothing would make an intoxication. But what would make it an intoxication? Well, multiple animals in a household effect, okay? All right? we've got common things happen commonly. We've got a potential exposure to something like ethylene glycol that's relatively common. Somebody decided they were going to teach their 16-year-old son or daughter how to change their radiator fluid. Okay, and when my dad tried to teach me how to do it, it turned into a 12-hour ordeal. Thank goodness there were no dogs around, because it was chaos. But so then we figure out, okay, could there be an intoxication? What would be the differentials? And then if we're going to look at and try to diagnose something, we're going to think, well, is there evidence of exposure to some toxicant? Okay. All right. And then we get into how much that could be. And then what are there consistent clinical and diagnostic abnormalities that go along with that? We add that all together, and then we go ahead, when we talk about intoxications, we talk about how are we going to go ahead and treat it? Well, we're going to remove from the source, we're going to stabilize supportive care, and then we're going to try and prevent it. In the case of ethylene glycol, what you're left with most of the time with treating is we're going to use ethanol, or we're going to use 4-methylpyrazole. People call it fomepizole. I had a student who one day in the parking lot said, Dr. Evans, I want to do emergency medicine, and you taught me about 4-methylpyrazole, 4-MP, but you never taught me about fomepizole. I said, okay, let's just 4-methylpyrazole. Fomepizole. There you go. Okay.
You were just talking about it.
Yeah, but again, and you could get 4-methylpyrazole or ethanol, Everclear. I mean, I'm in Missouri. You just go to your corner liquor store, and there's a variety of protocols you use, but you give the animal IV ethanol, 30% solution, a bolus dose. Then you keep it on a continuous infusion for a period of time. If you can get 4-methylpyrazole for fomepizole, you dose a number of multiple doses, but you're doing that to prevent the animal from making some of the more toxic metabolites of ethylene glycol. Okay, so that's how we address that. But you got to get after it quick. If if the dog or the cat is already in kidney problems, there's not a whole lot you can do. That's the unfortunate part. So that's kind of how, that's that aspect. We kind of talked about, how do we work up a case? How do we talk about these things? How do we treat something like ethylene glycol? Let's go to another common problem that would affect the kidney. Let's talk about grapes and raisins in dogs. Okay, so for some reason, never in my mind did I think, I got a dog, I'm going to give it a treat, let's give it a grape. I just never quite occurred to me that was, but a lot of people like giving grapes and raisins to dogs. I mean,
I get it. I totally get it. It's a perfect little treat size. Like you're there, you're eating it, it's mostly water. You go, how could this be bad? And I totally get it. I totally get it.
Well, to see, that's why you're where you are as the host of the Cone of Shame, and I'm a toxicologist. So, so we've talked about it's probably been close to 15 years where the Animal Poison Control Center brought attention to the fact that they were seeing problems with grapes and raisins. And some animals seem to be particularly sensitive. I mean, some animals, it takes a boatload of grapes, maybe a little, maybe less in the way of raisins. But some dogs, little dogs, you get a box of raisins, and they go into renal failure. I mean, so that's an interesting in that case. We've got different kinds of intoxications where we have differences in sensitivity of different animals. And in this case, Some animals are much more sensitive. Dogs, just it's a dog thing. In my mind, it's a dog thing. You've got grapes and raisins, and particularly raisins, because whatever it is, we didn't know what the toxin was, but now the belief is that tartaric acid or potassium bitartrate are somehow involved in that. We don't know how, but we don't have really a way to test for it. But what happens is the dog gets into it, they start vomiting, and then they end up with the tubules in the kidney, which play an important role in what the kidney does, basically are damaged. And then we get into renal failure and kidney failure. And so, this is one of these things that I'm kind of, I tell people, just don't give grapes and raisins to your dogs. And I actually, I was trying to get my haircut yesterday because, I was coming on the cone of shame, and my regular barber shop, they were closing in 10 minutes. And so I went to a new barber shop, and the lady there says, and I was dressed, don't ask me why, but I had an MU shirt on and wearing my tiger stripe pants. Okay. Wearing my tiger stripe pants. It doesn't leave much to the imagination of where I work. And she said, I have a dog. I have a French bulldog. And I said, wow. And I said, if you could tell me anything, you said you're a toxicologist. If you could tell me anything, what should I not do? I said, well, don't give it grapes, raisins. Don't give it chocolate. Don't give it those kinds of things. It's a dog. Get dog treats for the dog. Okay. But, but so then she asked about grapes and raisins. Well, grapes and raisins, I always think that, and she said that. She said, well, they're so much fun, and when they eat them, they explode. And I said, no, that's a less than ideal thing to do. Now, again, how many times do we get phone calls from somebody who says, oh my gosh, my Great Dane ate one
grape.
Great. Well, that's probably not going to be a problem. And but what we do need to recognize is, has that dog ever had that kind of poisoning before? Has that dog had grape and raisin intoxication? If it's had it before, then yes, maybe one grape, particularly multiple raisins, might be an issue. But I think this brings us back to a lot of things, and dealing with pets and with organ function. I mean, the kidneys, we don't really know they're not working until they're really not working. And so, we go ahead and we see an elevation in the blood urea nitrogen or the creatinine, and we go, oh my gosh, but we don't always. And a good example of this grape and raisin analogy, you talk about in dogs, I believe it's a dog thing. Anecdotally, some people say, well, there may be cats. There's been reports of cats having kidney problems, and they've ate one raisin. Okay. Well, as you and I both know, cats are basically chronic kidney disease waiting to occur. And so I love cats.
Oh, yeah,
My best friend is a cat, but I'm not giving it. I'm watching out for his renal function. But what happens is a cat eats a raisin, and then the cat's not feeling well, and somebody goes ahead and does the blood work, and they see the cat has renal disease, and now it's got to be because it ate the raisin, not just because it's a cat. And that brings us to the point of going ahead, and when we get our patients that come into clinics, I always think it's a great idea to get baseline blood work. Dogs coming in for a puppy check, or even a dog's coming in for its annual shots, whatever, getting that blood panel and looking at are we seeing any type of changes in the red blood cells, white blood cells? Are we seeing anything in the blood chemistry indicative of potential liver disease or kidneys, something like that? That gives us some baseline information that we can go back and then go ahead and figure out. So when I'm talking about cats and grapes and raisins, and I don't think that's a thing. On the other hand, we've got cats and true lilies. That's a thing. Okay. And so, I think a lot of this is trying to organize those thoughts and put them in. And again, teaching veterinary students, I'm trying to get them to think in terms of a system of how do you look at things and put it together. And in the case of cats and lilies, true lilies, Lily is like Smith of the plant kingdom. Okay, everything's a lily, but the true lilies, the Lilium genus, the Hemerocallis genus, which is your Easter lily, Asiatic lily, all of those other lilies, and then your daylily, those potentially can be associated with kidney disease in cats. Even the pollen is enough to cause a problem. We don't know what the toxin is. We know that if the cat eats even a tiny bit, that it's a potential problem. You go ahead, you take it to the veterinarian. You go ahead, you put the animal on fluids. Usually we put it on IV fluids for about ideally 72 hours. Sometimes we can get away with less, but it's an emergency. I mean, it's like the Great Dane and one grape, not an emergency. The cat who's got yellow pollen all over its face from, and it just happens to be Easter, or it's prom. Everyone at prom time's got to have lilies. So and then we go from there. And so those are the kind of things that we think about.
Dr. Tim Evans, you are amazing. Do you have any favorite resources before we go that you love for people who are like, I want to brush up on toxicology, or this is really an area of interest for me? Anything that you like that you point people towards?
Well, I would say that I think the poison control websites, particularly the Pet Poison Helpline and the ASPCA Animal Poison Control Center, great websites. Phone apps. Certainly, you can call for a consultation, but they've got lots of free resources that can answer a whole lot of questions. And there's a number of pretty good textbooks out there that give us some good information. So I love what I do. I hope I've met your requirements for maybe coming back to the cone shape again. So
the stringent requirements for return visit. I think so. I think you far exceeded what I hoped for. This has been wonderful. I appreciate the heck out of you. Guys, thanks for tuning in and listening, everybody. Take care of yourselves. Be well. And that's it. That's what I got for you guys. I hope you enjoyed it. Thanks to Tim for being here. Thanks to Hills Pet Nutrition for making this episode possible. Gang, take care of yourselves. Enjoy practice. Be well. I'll see you soon. Bye.